Hi, my name is John Stan. I'm a doctor of Chinese medicine, and I want to introduce Dr. Dan Lobash. He's a Korean hand therapy specialist. He's been practicing for over 25 years doing Korean hand therapy. And I myself have learned from Dan some of the basics of Korean hand therapy. And I must tell you that I've used the system in many different settings with great results. And we're excited to announce that this EC Learning will be offering an introductory course on the basics of Korean hand therapy. And I want, Dan, can you tell us a little bit about this online course?
Yeah, thanks, John. This is a first opportunity to help spread this further and wider than we have been able to do this. So we're grateful for the opportunity. The basic ideas of Korean hand therapy is why like John said, I've been doing it for 25 years. What has continued to inspire me is that it's easy to learn. You get instant results from your patients, either instantaneously, if it worked or it didn't. It can be done non-invasively because the hands are so sensitive. You don't have to use needles on the hand. And if you do use needles, they're very, very tiny and very thin and pretty much unpainful. So there's that part of it, and it's easy to learn, it's fast to learn. You can immediately integrate it also with anything else that you do, whether it's body acupuncture, or whether it's if you're a Western person. We've taught a lot of nurse practitioners, medical doctors who are interested to have another modality for their patients. You can integrate it with anything, and in fact, some of the research shows that if you combine systems, you'll actually get a better result than if you just do any one of the, for instance, microsystems like auricular or hand or foot alone. So I'm really excited to be here to offer this.
Well, and that's what I really liked about the KHT system was that as a practitioner, sometimes you don't get quite the results you want at the end of your treatment, and then I was able to throw in a few pellets to on the appropriate points and be able to offer another 10 or 20% reduction in pain,
Right.
and sometimes even greater, where it would be maybe 50 to 60, 70% relief of pain.
Right.
And often on the fly, when I wasn't in the clinic and people were complaining about headaches or shoulder pain or knee problems, again, I could do a treatment on the fly and have fantastic results.
Right.
Very quick and very simple. So Dan, who would this course be appropriate for?
Just about any alternative or integrative healthcare practitioner. If you're interested in giving your client more benefit and the benefit of working with the energetics of the body, whether you're a nurse, whether you're an acupuncturist, massage therapist, a physician, a medical doctor, a chiropractor, just about any person, a naturopath, because we've taught all of them in the last 25 years. So anybody can benefit, and through learning this, they can benefit their client in a way that they couldn't without it.
And can you give a little example of some of the things they'd be learning?
Well, they'd be learning, basically you have to start out with how is the body projected onto the hand.
That's true.
So that's like the foundation. And then there's some little tricks on how do you search for and find the appropriate point that is going to give you the best result. So that's like the next step in the learning. After that, then, how do you stimulate the points? And it covers everything from little tiny needles to little metal pellets to magnets to lasers to tuning forks to using sound and vibration. There's a lot of ways that you can stimulate the points on the hand.
Right.
Again,
what I liked about it was that actually you don't need any fancy methods. You don't even need needles. For practitioners that don't have needling in their scope, you can just use a little simple pressure, or little pellets that are specifically designed to provide the right amount of stimulation to the Korean hand therapy points. But basically, once you take the course, you're pretty free to go out there and make some dramatic changes in people's pain levels quite easily. We're going to sort of flip to a little clip that shows a response of one of the individuals that we did a little sample treatment on, and take a look at to see how amazed he was with his results. And this is just after a 5-minute little searching and treatment.
So what we did is we tonified the gallbladder Now what I want you to do is stand up and move your leg again and see how our theory holds up. It feels the same.
It's just feeling so good. I don't know.
It's feeling good?
Yeah, I don't even know how to compare it because it's actually quite foreign to feel that loose. Yeah,
loose.
so it's hard to compare actually just from the first.
Right.
Yeah.
Right. Okay. You could see how excited he was because you could see it in his face. He didn't expect it to work.
Oh, yeah.
You know, he really thought, well, is this like a placebo effect? But he could see that it wasn't. That he got like this instantaneous pain relief. In fact, he hadn't been scheduled to attend the seminar, but he said, I want to learn how to do this.
It's true.
You know?
And I've seen these results over and over and over again,
Yeah.
both personally, and I've witnessed Dan at various times, trade shows or at the courses that we've organized, produce over and over again these types of results. So I hope you join us with this introductory course on KHT, Korean hand therapy, and the instant pain relief that it will provide your patients. It's fun, it's easy, and it's simple to use.
Mm-hmm.
And Dan's a consummate lecturer, so he provides that information in a very understandable way. So we look forward to having you join us and learning from Dan Lobash, master of KHT.
And I want to add one last thing, John.
Okay.
And that we emphasized, or it sounded like we were working on pain problems or musculoskeletal, but the title of the course is Korean Hand Therapy for Instant Pain Relief and Functional Problems. So
right.
if they've got digestive issues, reproductive system issues, breathing issues, heart, anything, all of the systems can be addressed through this method.
That's right.
Yeah.
Okay, we'll hope to see you there. Thanks again.
Thanks for watching, and we'll see you online.